Welcome to the Health Flow Podcast. I'm your host, Jean Armand. Join me weekly as I share health information that will educate and inspire you. Please consider supporting this podcast by listening, subscribing, sharing, and rating. Once again, welcome to the Health Flow Podcast. Hey everyone, welcome to the Health Flow Podcast. I'm your host, Jean Armand, and this month is Breast Cancer Awareness Month. So I hope you all are, especially my female listeners, and this is definitely also for the males. Um, this is the month to be aware of breast cancer. Um, let's talk by just talking about breast cancer. In all actuality, the real cause of breast cancer is not known. Um, and first of all, let's do the myth busters, okay? Um, there's many myths out there, but as far as we know, and you can check all my facts on the nationalbreastcancer.org, um, breast cancer is not associated with caffeine use. Breast cancer is not associated with the microwave, use of the microwave. Breast cancer is not associated with your cell phone. Breast cancer is not associated with, is not caused by wearing an underwire bra. And also, breast cancer is not caused from having breast implants or your deodorant. So, those are actually myth, guys. They really are, meaning there's no scientific proof that breast cancer is caused by your deodorant, drinking too much caffeine, wearing an underwire bra, having implants, and your deodorant or cell phones. And if I didn't say microwave. Those are myths. Um, Breast cancer does occur 100 times more in females than it do in males. So, of course, our focus is then females because that's who it occurs in more often. What is important to understand is what are the potential risks of breast cancer. But first of all, let's just start by saying cancer, not just whether it's in the breast, is just when a cell, like the genetic material or DNA of a cell, gets damaged. And it can be damaged by different things, such as environmental causes. That's one of the things that can damage a cell, or, your genetic. So when a cell, the genetic, or we say the DNA of the cell is damaged, then that's how it then translate into being cancer. I'm just trying to make it just real simple. Um, but in actuality, the real cause of why people, women and males get breast cancer is unknown. So there are genetic factors that are risk factors. And some of the genetic factors um, that are unchangeable, or I should say, the genetic factors that are unchangeable are your age, your race, your family history, whether you had your menstruation, a female started their menstruation early or when menopause came late. And late menopause is if you have menopause after 55. And then your personal health history. So those are things that, you can't change your race, you can't change your age, can't necessarily change whether you started your menstruation early, and you can't change when you're going to stop, if you stop before 55 or not. So also, this is important piece is that breast cancer is diagnosed in Caucasian women more often than any other race. It doesn't necessarily mean that breast cancer occurs in Caucasian women more often. The things that I said diagnosed. So that means that Caucasian women may be getting more mammograms more often. They may be finding, a clinical exam by their physician is done because they're getting the annual checkups more often. So that's something really to look into. So to make sure that all race females are, one, doing your monthly breast check. Once a month, every woman should be checking their breasts. If you're greater than age 40, you should be getting a mammogram. And when you do your annual physical, your doctor should be doing, that's what they would call a clinical exam. So just keep that in mind. That's the whole promotion. And yes, a woman may find a lump, but actually a mammogram is sometimes breast cancer is diagnosed when you haven't even felt anything. You had not had any symptoms. That's how sensitive the mammogram is. And what exactly the mammogram? Mammogram is just an x-ray of the breast. And another fallacy, I get my annual breast exam, annual mammogram. And yes, it's uncomfortable because the machine comes up. You have to actually have your breast between two clear plastic, and it presses down, and then you hold your breath and they take the x-ray. That does not cause breast cancer, just let's be clear. The such minute amount of radiation that you receive from that is not associated with cancer. And just like in my previous podcast, when I don't recall what episode it was, but my friend that was diagnosed with breast cancer, she had no symptoms. She just went for her annual checkup. That's how it occurs with most women anyway. But it is important because you can find a lump. And when you do your breast exam, it's not just that you're looking for a lump. So you can be in a position that you're most comfortable with. All women, one breast may be slightly bigger than the other in most women, not all. But if you notice a significant difference in the appearance of one breast versus the other, a dimpling or retraction, like a drawing in of any area. They talk about the orange peel appearance, meaning the skin of your breast looks like an orange peel. And think about an orange peel. It looks like it has large pores. The skin on our breast usually does not have a large pores. So if your pores on your breast appear to be really large, that's something. If you're having nipple discharge, whether it's clear or it could even be bloody, that's a problem. That's something to get checked out. So your self breast exam, and when you do your self breast exam, it should include your underarm. You can do it lying flat. on your bed. You could do it in the shower. You can do it standing up, looking in the mirror with one hand behind the neck, and just with the pad of your fingers. I was always taught that you start and you don't lift your hand up, just in a smooth circular motion. You go all the way around, small, all the way until you actually get to your nipple and you actually squeeze. And then you change over and put the other hand behind you. I start right at the top in the center, and I go all the way around, not lifting my hand off, but just getting closer and closer without each motion. And I also make sure that I check my arms, because your axilla, your armpits, to make sure there's no enlargement. So that's how you would do your self breast exam. Now, like I was said before, breast cancer is diagnosed more often in women, Caucasian women, than other races. If you have a relative that's diagnosed with breast cancer before age 50, that puts you on a higher risk of getting breast cancer, just a higher risk. Doesn't mean you have to get it, but your risk increases. Once you're diagnosed with breast cancer, one of your breasts could actually, in one breast, it is a higher risk that the other breast is going to have breast cancer at a later age and at a later time. And that's why a lot of women are faced with having double mastectomy. So they give you that as an option, because it's not usual that a woman gets diagnosed with breast cancer and she has cancer in both breasts. It can be. It depends if it's a later stage. She has them in bilateral breasts. I've certainly seen that, but the most of the time it's usually one breast. And I mean, this is something that you wouldn't take lightly, as far as having, double mastectomies and things like that. It's a whole long process. It's a treatment. It's a team treatment approach. I know that I personally have a friend now that's going through that, and just the research, the different teams, not, you're having the surgeon, you're having the surgeon that, the general surgeon, then you may have a plastic surgeon who will do the breast reconstruction, then you'll have an oncologist, a whole team of people, nutritionist, just a team of people. It's a process for treatment. As I continue explaining risk factors. So early menstruation, that means you start your menstruation before the age of 12, and then menopause after 55. Or if you have your first child at an older age, or if a woman does not have a child at all. Those are things that actually put a woman at higher risk for breast cancer. Also genetics. I know we've heard about, if you have mutations, and mutations are changes in the BRCA1 and BRCA2 gene. That is also a increased risk for breast cancer. But you cannot find that out unless you go through genetic testing. So that's not something that's easily, unless you have genetic testing, you're not going to know if you carry the BRCA1 or BRCA2 gene. And if you do carry the BRCA1 or BRCA2, and it's BRCA gene, then that puts you at a higher risk. Another thing that puts a woman at a higher risk is to have dense breast tissue. So dense, thick. So they're saying that if you have dense, DENSE, breast tissue, that also puts you at a higher risk for breast cancer. I know now in some states, that it's I think they're supposed to leak. It is the results of the mammogram is supposed to include whether the tissue of your breast is dense, so that you know to be on alert and look for it. Some states require that the mammogram results tell you if your tissue is dense or not. So other causes now, environmental risk, of course, and there's so many different things with our pollution in the air. So that's environmental, and that's why we are saying that the exact cause just is not known. Your lifestyle. So lifestyle, if you have what they call sedentary, if you're a person that you're not exercising, you have very little or no exercise activity, that actually increases your risk for breast cancer. Your diet, a diet high in fat. So a fatty diet increases your risk for breast cancer. You need a diet that's lower in fat, higher in fresh fruits and vegetables. Obesity, if you're overweight. I've said this many times, being overweight increases your risk for many cancers. Frequent alcohol consumption. And if you had to have radiation treatment before age 30, that increases your risk. And I want to also add cigarette smoking. Cigarette smoking is associated with many cancers, including breast cancer. And if a woman had hormone therapy replacement, that also increases their risk for breast cancer. So the take home from all of this is that, first of all, early detection is the key with every cancer. Early detection, when we say early detection, it means that the cancer is found before it had an opportunity to spread to anywhere else. A cancer that's contained, localized in one area has a much better chance of treatment and you surviving the treatment. But a cancer that has metastasized, that's the word they use, meaning it has spread already. This is a different situation because now the medical community, your medical team, they don't just have to deal with the one area, but wherever it's spread to. So breast cancer, if breast cancer is found early, meaning you just find a lump and it's just right there, you can just have a lumpectomy. They remove the lump and you may get treatment with radiation for that one little area to make sure the edges or the margins are clear. But now, what if it's found and it's already spread to your lymph nodes? That's something more difficult to deal with. Breast cancer can spread to your lungs. Then it's difficult. Or any cancer that have already spread to your liver. So that's why in all cancers, and that's why it's so important to do your self breast exams Know your family history, first of all, because if you have history of near relatives, your mother, your sisters, you're going to be more on high alert to make sure that you get your mammograms age 40. Now younger women are getting breast cancer. And you can get a mammogram earlier if your family history is saying that you should. If if I know that my mom or my sister has it, then that's maybe I'll be in a situation where I'm going to fight for genetic testing. And I know that's not exactly affordable for everyone, but do what's in your means. And now that we're talking about affordability, go to the nationalbreastcancer.org. And according to your states, they can give you facilities that will do free mammograms. Most places have your community hospital will have places where you can get free mammograms. And especially in the month of October that we're bringing awareness. I know that with COVID, things are a little bit different this year, but you still cannot afford to ignore your breasts and not have your mammogram. Don't be afraid of COVID and delay your mammogram. I had mine in June. I had to do it. I need you all to do it. Do your self-breast exam, have your annual mammogram. Know your body, know what your breast normally looks like. If you're not looking at them, you're not gonna understand. You're not gonna see the minute changes. If it's found early, it can be treated. Exercise. We're back to the same thing. Low-fat diets. Get moving. Get your steps in. Exercise. And obesity. Let's fight obesity. Decrease your alcohol consumption. No smoking. That's cigarette smoking. That's 2 thumbs down, definitely. It's bad. It changes cells. So that's my take home. Be aware, get moving. Let's kick this breast cancer stuff in the butt. I'm sure you know many people who I know I do, who have either passed away from breast cancer or is now dealing with breast cancer or have beaten breast cancer. Let's get into the fight. Let's fight against breast cancer by one, exercising, get moving, get rid of the fat in your diet, fight against obesity. You are all worth it. You're worth it. You're worth it. You're worth it. Let's live longer and healthy. And men, let's not forget about the men, even though women have it 100 times more often. Men, check your breast too and know what it looks like. Be comfortable with your bodies. Be your body advocate. Just have your annual checkup. Make sure your doctors are doing your annual breast exam, clinical breast exam. Thank you all again for joining the Health Flow podcast. Let's spread the word. Let's live healthy. Breast Cancer Awareness Month, but it's every month because every month you should be checking your breast. All right, y'all. If you have any questions or comments, don't forget to email me at thehealthflow, that's FLO, at gmail.com. If you have topics of interest, please just go ahead and send me an email. If you want to be a guest, I'm all for it. Come on, let's talk about your experience. It may help someone. Share and like and subscribe. Continue blessings to you all. Thank you for listening to the Health Flow podcast. Your support is much appreciated. It is my goal to share health information that you find helpful. Email topics of interest to thehealthflow@gmail.com. Follow me on Instagram @thehealthflow, also on Facebook @thehealthflow. Don't forget to subscribe, rate, and share. Until next time, keep your health flowing.